Slow down, connect, and make your patient feel heard. That alone can change outcomes. Okay, so we want next slide. I want to talk about COHI, their mission. First off, I want to thank Sandra and Gary and all the members of COHI for giving us the opportunity to help make a real difference. And an even bigger thank you for all you do for the Connecticut residents. Healthcare is increasingly recognizing that patient experience directly impacts clinical outcomes. In dentistry, fear, misunderstanding, financial factors, cultural barriers, and past trauma can prevent patients from seeking or continuing care, as we all know. Programs like COHI emphasize that oral health can and must address not only clinical needs, but also communication, trust, and accessibility. I did not know that COHI existed prior to accepting their internship, but I'm happy to support them and know an organization like this exists. COHI focuses on systematic change, legislative impact, and statewide equity. It gives me hope that they can be changed and change for the better. I hope this webinar, even in a small way, can further dental care experience both for the provider and the patient. Our next slide. Oop.
Can you see my slide?
Yes, I can. Leslie, your speaker's close, honey.
So sorry about that.
It's okay.
Good evening, everyone. Thank you for joining. Dr. Waterman has worked in a number of public health and private practice settings. He has developed a style of practice which focuses on educating people to make informed treatment decisions, drawing on years of professional experience and through a network of trusted specialists. He firmly believes that what can be done is not always what should be done, and that active listening and discussion with each patient is essential to give their ownership of their oral and overall health. He's a graduate of the Loomis Chaffee School, Butler University, and the Baltimore College of Dental Surgery, Dental School, and the University of Maryland.
Hi, Dr. Waterman. If you want to say hi to everybody, thank you for joining us today and giving us your expertise. We're excited to have you.
Hello.
I would also like to introduce Leslie Mantello, the member of COHI. She is a registered dental hygienist in a private practice in Connecticut. She is attending the University of Bridgeport, pursuing a bachelor's degree in hygiene. She is passionate about oral health advocacy, oral disease prevention, and aspires to make an impact on public health. She graduated from Lincoln College of New England with a dental assisting certification and an associate in science degree in dental hygiene. Her background lies in volunteerism, interning, and delivering dental health care services. She admires the positive impact COHI has had on their communities and its accomplishments in making oral health services accessible to everyone.
Thank you, Noshelle. And I would like to introduce Noshelle. She is a dedicated dental professional with a strong passion for patient advocacy and a proud member of the Connecticut Oral Health Initiative, supporting communities from Alaska to Connecticut. Working with COHI has been a dream come true for her, and it is fueled by her passion for public health. Noshelle is actively involved in Give Kids a Smile, serves as a social media manager for Connecticut Dental Hygienists Association, and volunteers with the Connecticut Mission of Mercy Dental Clinic. She also contributes to Colgate Bright Smiles, Bright Futures. Looking ahead, Noshelle plans to pursue her Master's of Business Administration with a focus in healthcare administration, while continuing her education in myofunctional therapy to further expand her impact in patient care.
Thanks, Leslie. It sounds so nice. Next slide, our objectives.
So, in this presentation, we will be covering how we will show up as dental professionals for our patients and the ways to improve oral health outcomes for our patients. The ways we can make the overall experience more tailored and comfortable, how the use of language can impact interactions with our patients, barriers can be based on financial, educational, psychological, and locational factors. From the beginning of the appointment to the end of the patient's visit, all dental staff need to be on the same page. We are not striving for perfection, but aiming for improvement. We encourage questions and discussion for this webinar.
All right. In our next slide, we are going to talk about why patient experience matters. I think we all can agree there's still a stigma around dentistry. Sometimes we're seen as just selling treatment instead of being recognized as healthcare providers focused on prevention and overall health. Our job is to change that by helping patients understand why oral health matters and how it connects to their overall health. When patients understand the why, they're more engaged in their care. That's where patient-centered treatment comes in. It's about collaborating with our patients, listening to them, involving them in decisions. When patients trust us, they're more likely to accept preventative care, follow recommendations, and return for regular visits. So the patient experience really drives everything. It improves compliance, increases treatment acceptance, encourages prevention, and leads to better outcomes. There's even an economic impact through long-term practice success. At the end of the day, we are all the foundation of prevention and oral health care. So with that, I'd like to bring Dr. Waterman in on the conversation. Dr. Waterman, why does patient experience matter to you, and how has it shaped your career?
I think it's just in general. I mean, I don't know how many, what we have out here for the professionals that are in our audience tonight, but I mean, if I had a nickel for every time a patient said to me, "No offense, but I hate the dentist," um, I would, it it just drives home the point that that you need that you said trust is the most important thing.
Yeah.
And the only way you can get trust is by people understanding what's going on. So, you kind of alluded to the whole idea of, getting understanding and ownership. You need to, you need to let the patient know, what you're about and what's happening, because people don't get scared necessarily of the procedures. They get scared of the unknown. And when you're starting that relationship with the patient, you have to make sure that you're talking to them in a way that they can understand. Um, and I'm very clear with that with them. You have to kind of acknowledge, like, hey, you know, let's start this from square one. You know, this is
No,
why I'm here. This is what we have to do, and kind of let's move forward from there.
yeah, I think it also builds trust with the patients, which is really important. I feel like they don't get that everywhere they go, so it's important to show that to them.
That it's out there and it is possible.
Agree.
Yeah.
Thank you. All right, next slide. Okay, for everyone here, how common do you believe dental anxiety to be among adult patients?
We'll give you a moment.
Very high from trauma in their childhood.
Yes. Okay, so now that we all thought about it, well, approximately 36% of patients experience dental anxiety, while 12% experience extreme anxiety. And I've recognized that just in the short time that I've been practicing. But one way I can tell if my patient's super anxious, I always take their blood pressure, before appointment, even if I don't feel that they're anxious. And 9 times out of 10, the blood pressure comes back pretty high. Either they tell me, oh, I'm on medication, blah, 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 or they say, I have extreme dental anxiety and I am so scared. So I always find that blood pressure is a good way to also just be like, hey, what's going on? And they're usually like, oh, wow, she actually cares. So I always say, blood pressure, blood pressure, blood pressure, take it. Okay. And next slide. We're going to talk about, go more into dental anxiety. We have some 12%, 36%, and that's also why they delay their care. Patients should feel like there's no stupid questions. Patient is asking a question is major because that means they're interested in their care. We aren't gatekeepers as dental professionals. We serve as a resource for oral hygiene knowledge and care. An anxious patient may feel nervous if you take the time to explain the process and the why. Common causes of dental anxiety includes fear, I think what Dr. Waterman was saying, loss of control, negative past experiences, and embarrassment of their oral health, what their mouth has come to. So I think if we just figure out why they have the anxiety, it's good to, let them ask questions and make them feel comfortable that no question is stupid. Okay, next slide.
Yeah, can I just
So next,
piggyback off that a little bit? I mean,
Yeah.
I
yeah.
think that's one of the main things that I tell patients is, because there's so many patients that, as you said, they feel, it's almost like they feel guilt, and the fear is kind of comes out of that in a certain way. And what I tell them, it's like, there's no wrong way for you to be in the dental chair. I tell that to them, it's straight up. There is no wrong way for you to be in the dental chair, you know, because they're like, oh my gosh, I'm the worst patient you've ever had. I was like, first, you're not the worst patient I've ever had.
Right.
And second, it doesn't matter, right? You are what you are. You're in the chair. We need to get you from wherever we're at to wherever we're going. Let's get rid of all of the guilt or any, like, let's find out how are we going to do that. And
Right. You're
again,
here
it's being
now.
very,
It's never too
very
late.
clear with them about that. It's just that, like, look, there's no right or wrong way. So,
Agreed. Thank you, Dr.
Thank you.
yeah.
So next we will be creating a welcoming environment. So that welcoming environment does start as soon as the patient walks in, because first impressions truly matter. And when we talk about creating that welcoming environment, we're talking about health equity. So making sure that every patient, regardless of their background, insurance, status, feels respected, valued, and cared for. So I usually like to start with saying something simple as, "Hi, my name is Leslie. I'm your hygienist, and I'll be taking care of you today." Just in that small interaction, you can immediately ease the patient's mind and reduce anxiety and build trust. From there, it's about the environment we create, such as like soft music I like to play, the use of calming visuals. Tend to give patients dark sunglasses to reduce like the amount of light that gets into the patient's eyes, and even suggesting the patient wear their own headphones to listen to their own music. So, what is important is also how we respond to our patients. So, when we are being told about the patient's fears and anxieties, we really have to acknowledge and have an active listening. So, such as nodding and validating what they're feeling. I do something such as repeating back what they said, using calm, empathetic language, and at the end of the day, those small actions make the biggest impact. Friendly greetings, introducing the dental team, maintaining eye contact, and using inclusive language can be really important. With these simple steps, you don't just improve the patient experience, you help create a more equitable, compassionate system of care for everyone. And Dr. Waterman, how would you create that welcoming environment?
I think the major thing that I've found in my career is I kind of call it mirroring. Um, you have to gauge the energy of the patient. I mean, well, Leslie, I've worked with you before, and you'll have a patient that comes in, at 7:05 for their 7 o'clock appointment, saying like, I have a meeting this morning, I need to be out of here at 7:40, right?
Yeah,
But they also don't, they also, I am always sensitive and stuff like that. And so you have to acknowledge the fact that they're still a nervous patient, but they're
perfect.
also like a type A, like trying to like, kind of get going. And so you're not, you might be less like kind of, fluffy with like how, gentle you are. You'd be like, I'm going to get right to it because I know you want it. But then there's the patient that
Right.
comes in and you're very mousy and like this, and you have to just talk like very, very softly and like, everything's fine, everything is good. And just kind of mirroring that energy that the patient has, because it's really about, again, it gets back to the familiarity thing. They need to understand that you get them and feel that they're it's not just about like building trust. It's actually living that trust, right? Like
Yeah,
making that connection with the patient so that they feel comfortable and they're just like, oh, this is a normal thing. That's the key. You want the dental visit to be normal because for you it's normal.
right.
And most of the stuff we do, in the dental chair, in the hygiene chair, it's not fun, but it's no worse than like, picking your eyebrows or doing all sorts of things that you do on like a normal day
Right.
that hurt or are much more annoying, right? Like, and I always tell patients, you go out for a hike, if you go for a hike, in the brambles and all that kind of stuff like that. You come back and your legs are completely cut up and you don't remember any of that. But if I were to come and make one of those little cuts on your leg, you would absolutely freak out. And
Yes.
so where your mind is most of what it is. Pain. I mean, obviously, it's not all about pain, but if you think about just pain, pain is not the nociception, right? It's not the signal that comes from the nerve ending to the brain. It's your perception of that. So
Mm.
if you're not in a place to be able to accept, some slight discomfort, then you're going to have a bad day. If you're thinking about like the joke that I just said, or the fact that like, you like the music that's going on there, then you're like, whatever, because people can handle pain. People can deal with a little bit of discomfort. They can't deal with BS, and they
Yeah.
can't deal with the unknown. So
Correct.
that may be a little off tangent, but I mean that's the environment. It's mirroring. It's getting the energy kind of synced up so that they feel like they're just hanging out with a friend.
No, that's a good point. And I think also treating them how you'd like to be treated in the chair is
Oh,
my
totally.
biggest. Yeah.
Golden rule. Golden rule works pretty well most of the
Yeah,
time,
if it
doesn't
was
it?
my grandma, how would I want my grandma to treat someone? So that's what I
Precisely.
go by. Thank you for that. Okay. Next up, we're going to be discussing, next slide is technology and patient understanding. So modern technology can enhance patient experience. I think we all know digital imaging, intraoral cameras, wellness scans, and salivary diagnostics can enhance patient experience and add an element of excitement and I guess change for the provider and the patient. Intraoral cameras are great for before and after photos, describing what the patient is seeing, especially in areas that need improvement. I find mostly patients can't see, the lingual aspects of their teeth, so they need to be able to see it. And some are like, "Oh my God, that's disgusting. I did not know there was back there." So it just also helps with them accepting treatment and what I'm, saying they need. Um, and doing this can make it like personalized care. This may help our patients make an effort to improve their lives. Intraoral photos are great for showing progress or decline. Either way, it's an amazing, comprehensive tool for our patients and the provider. You also want to provide reassurance to your patients. This improves patients' understanding. Again, like we're talking about, builds trust and encourages preventative care. You also want to be candid with your patients. I think that's one of the biggest takeaways we'd like you to have. Prioritize the patient's problem areas and where there needs to be improvement. Many companies offer free educational tools. I think I just told Leslie that the other day. Like typodons and toothbrushes, just to like help you show them how to use certain things that they should be using. Another great way to understand your patient is to ask them about their goals. Why are they there today? The best is to meet your patients where they're at with their oral health care. This means recognizing their circumstances regarding their current habits, routines, their motivations for maintaining their oral health. Um, and this may be achieved over time, not right away, or over the span of several visits. Continuation of care is very important for building trust and connection with your patients. Okay, next slide.
So, how to reduce fear and anxiety? An easy way to gain patient trust before any procedure, I usually tell them to raise your right hand if you feel any kind of sensitivity. I'm left-handed, so I tell them the right hand. So when they lift their hand, they're not bumping into my arms. But if you're a right-handed provider, you can tell them raise your left hand. Especially if they feel any kind of sensitivity. This gives them a level of control during their appointments. I also like to limit pressuring verbiage like you have to do this procedure, regardless of what it is. So instead, I'll use phrases such as, in my professional opinion. Gives guidance rather than forcing a patient to agree with the treatment because they do have the right to refuse treatment. That is something that you do have to keep in mind when you're speaking with a patient. And you really should explain why there is an indication for treatment and use simple wording and analogies. So a strategy I picked up is something called tell, show, do. This technique was developed by a dentist named Harold Adelson, and it's used to help not only children but adults alike. This method reduces fear and anxiety. excuse me, the goal of this is to give the patient a better sense of control. So other strategies to reduce anxiety is explaining procedure step by step, offering that stop signal, and especially encouraging patient questions. Using calm and reassuring language can also be a little cherry on top. And also allowing patients to take a break. We use a lot of water. We're in there for an extended period of time. They need to swallow. We're all busy in there, so we really do need to give them a moment because it's a lot. It's an hour, but it's a lot of things that we actually have to do and take the time for each of our patients. So in my opinion, a patient's biggest fear is pain, tooth or gum related, and no one wants to be in pain. So if an area is sensitive, such as like the gum tissue, you should be asking, how often are you flossing? How are you flossing? And what do you floss with? And I'll typically have them show me how they're flossing, and then I'll break down what I'm seeing, what we can improve, because a lot of the time they just don't know how to, when to, and so on. And I like to repeat like time, frequency, and technique can influence the health of our mouths. So making a patient aware of the need for improvement can define treatment patient outcomes. Dr. Waterman, do you have anything you would like to add to that?
Yeah, I mean, I think it's the same stuff we've been talking about. It's education, and with the pain thing, it's acknowledging, right? Like for all of this stuff, you need to acknowledge, what the patient is feeling, and not try to like hide it, not try to get away from it. Just be like, look, yeah, this isn't gonna be super fun, but again, you get back to the analogy of what your mind frame is, your state of mind is. The other one I like to tell patients is, if they have a sibling, if they've ever had situations where they've been wrestling with their sibling, and nothing hurts at all because you're just wrestling like this, and you're like, but then you flip it and you're in a bad mood, and you don't want anyone to come up and even touch you, like that just like sets you off.
Mhm.
So and again, it all comes down to, as you were talking about, like being reassuring, making sure people feel comfortable and familiar with what's going on.
Thank you. Next slide, please. All right. So, how many of you have experienced burnout? I'll give you a moment. See, Dr. Warren
Everyone.
raises his hand. I can imagine. So, research has shown that over 50% of dental professionals report symptoms of burnout, including emotional exhaustion and work-related stress. Did you know that over half of dental professionals report burnout symptoms? Burnout is linked to decreased empathy and patient satisfaction. The provider's well-being directly impacts the patient's experience. So certain things I like to do for my own fatigue, whether it be physical or mental, is using techniques such as yoga. But for any professional, you can literally search up uh, yoga stretches for insert profession here. For my job specifically, I'm a dental hygienist, so I try to do these relaxation techniques either if I have time between patients or at the end of the day or the beginning of my day. You work 8 hours sitting in the same position, you're doing the same motion over and over again. So all those little repeated motions can be very take a real toll on our bodies. So like I said, I'll do yoga stretches for dental hygienists, stretches to do between patients. Stress and tension can affect our ability to perform and show up as our best for our patients. Dr. Waterman, I know you do probably have some suggestions that you can offer for us.
For taking care of yourself so you can show up. Yeah, I mean, the older I get, I'm pushing 50 now. The more I realize that everything that people tell you in the past like is probably true. Like lately I've been doing tons of stretching, right?
Yeah.
I mean, but no matter what it is for you, be it working with your diet, making sure that you're taking breaks, you know, you do need to take care of yourself because if you're not in the right headspace, then there's no way that you can take care of your patients. But the other thing I'll kind of add on this, and this gets back to all the stuff we're talking about and being familiar with your patients personally, and people may not agree with me on this, but I use all of those struggles, in just kind of fighting off burnout, and life in general to relate to my patients, right? I think we're going to get to this later with cultural competency and stuff like that. But um, we all are human. We all live this shared experience, even though we have different kind of things that happen to us. But we can identify with things, and so if you can draw on your own experiences to identify with what your patient is feeling, and then also see what your patient is going through and recognize those things happening in your own life, that circle can be good. You can almost like learn from your patient can learn from you, and that just deepens that connection, and allows you to do what you need to do for the patient.
I agree for sure. And especially because even in their own personal lives, they could be experiencing burnout themselves, and that could be affecting why they're not doing their actual hygiene, doing their routine at home, any kind of health habits, again, deepening that connection between patient and provider.
Totally.
All right, next slide. I'm just gonna like piggyback to what Leslie and Dr. Waterman said because I have found like provider fatigue has immensely affected me, coworkers, my, fellow classmates who graduated. So I did like extensive research on this particular topic just because I find that it's overlooked. So when you hear my spiel, it's going to be pretty in depth, so bear with me. But just about provider fatigue, dental professionals experience burnout and physical discomfort, may unintentionally appear rushed and disengaged with their patients, which can increase your patient stress. Burnout in dentistry is more than just being tired. It's a combination of emotional exhaustion, detachment from your patients, and feeling like you're not making an impact anymore. This directly affects how we show up for our patients. If we're overwhelmed or under supported, patients feel that energy. Addressing burnout isn't one size fits all. It starts with recognizing it, identifying workplace and personal factors, and taking steps, whether it's advocating for some change, setting boundaries, or prioritizing self-care, which is probably my biggest thing I'm trying to learn is self-care. Um, Supporting clinician well-being improves patient care. The fact that you are here at this webinar shows that you are interested not only in patient care, but personal care as well. A dental office that encourages time off, office workshops, employee appreciation, and continuing education credits help to make a well-rounded, less burnt out dental professional. Offering morale boosting events or free workshops for dental office employees is a great way to boost morale, improve patient care, and strengthen your team's culture. There isn't high impact, practical ideas that you can easily implement. Encourage stress management and mindfulness. Mental health and wellness workshops are not just good for the employee, but the entire office. Implementing effective communication and conflict resolution with team building exercise, lunch and learn Fridays are also a great idea. Something as easy as morning stretches during your morning huddle can make a difference. Companies that offer free workshops for your offices, Colgate Oral Health, Crest and Oral B, GC America, and Dental CE Academy. And at the end, I have a list of all these at the end of the webinar, so you can, screenshot it and maybe bring it to your office. There's also a really great article from today's RDH that goes into burnout and it outlines recognizing early signs and contributing factors to burnout. I'll post that also at the end of the webinar. It just explains the importance of advocating for a supportive work environment, setting boundaries, and protecting work-life balance. It also explains about self-care and how it is not optional and it's essential. Exercise, nutrition, like Dr. Waterman said, and rest support resilience. Time for personal restoration improves patient care. Positive self-esteem improves coping ability. You cannot pour from an empty cup, is what I like to leave and that on is. You have to have a full cup. Okay, next slide. We're going to go into cultural competence. Leslie?
So, we urge and encourage you as providers to approach cultural differences with curiosity and respect. Recognizing that not every patient has had a positive influence or experience growing up in their life that reinforced proper home hygiene. I just had a patient in not too long ago telling me about how her parents were from Latvia and they would stress that chewing gum would clean their teeth. I did have to correct her because at the time, she was a much older patient. There really wasn't sugar-free gum, so they really weren't actually cleansing their teeth. They were actually just creating more issues with their teeth because of the sugar content. So I explained to her that today's chewing gums have something called xylitol in it that actually does help prevent cavities, and it helps with saliva production and keeping the oral cavity moistened, and it also aids in digestion. So, in the modern age, there's a lot of misconceptions or hacks that patients may bring to you as a dental professional. If you don't know the answer to a question, you should be honest and tell them, let's discuss this with the dentist. And even on your own, try to do some research because there's so much out there, I will say, like social media, infomercials, ads, all these things that can really cloud their judgment. And then another patient did tell me that they were told that flossing was bad because it hurts you. Again, I had to correct them and say that you could hurt yourself if you're doing it wrong. And then I proceeded to actually show them how to practice proper technique. So
You have some
breaking
crazy
down,
patients, Leslie. I didn't mean to stop you.
no, you are good. So breaking down those misconceptions with the patient is really important. And not just for them, but consumers, patients, individuals, they don't want to waste their time or their money. So providing your professional knowledge is key. So you can steer them in the right direction for their overall health. I also encourage patients to do their own research as well. So to continue that interest outside of the actual dental office. So strategies for better cultural competence include asking open-ended questions to inquire about your patient's level of awareness about oral hygiene. Avoid assumptions. This imposes your biases on a situation that can make your patient feel unheard. And then on top of that, too, not just their misconceptions, but also in the case of like having patients with disabilities, like having a translator or someone who is able to do ASL, and also demonstrating cultural humility by remembering that not every patient can afford to be knowledgeable about their teeth or have access to healthcare needs. And also being confident in their abilities to stay healthy. Dr. Waterman, can you provide any experience that you've had on this topic?
Yeah, I mean, I think just in general with cultural competency, you know, I see it as it, it's the provider's responsibility to remove as many filters between them and the patient. And the ultimate thing is it doesn't matter what the experience of the patient is coming into the thing, you need to connect with that patient. So what to me cultural competency is it's removing my biases and my and the clouds from in front of me so that I can actually accurately see the patient. Um, so sometimes it can be you come in with good intentions, like you have a patient who has a disability, and so you think, okay, well, I need to make sure that I'm taking care of this, and this, but really that might not be an issue for the patient. So it's really about being aware of, okay, there are there are things that are different about different people's experiences of the world and of receiving care, but then using that to springboard through that to ask the patient, find out from the patient what they actually need. Um, and I think that really is kind of that's the way I look at it.
And also circles back to like their goals, what they want to do with their oral health.
Right.
Thank you.
Thank you. Okay, next slide. Communication strategies. I think we all need to learn some good communication, so hopefully this helps. Real world analogies can be helpful in your patient's understanding of why treatments are needed. Tell the patient what to search when they're looking for products. I do that often. ADA accepted, seal of approval, Google things for them, take a picture, write down what to look for in the store, use a type dot to show the direction a floss needs to go, which I do commonly and often. Hand the patient a mirror while flossing and brushing their teeth, and ask the patient to repeat what they just were shown, so they can do this task at home. Be candid with your patient's needs, prioritize your patient's problem areas and what improvement is needed. But also don't let it get in the way of like where your patient is at that moment, what their goal can be. And this can be achieved, doesn't have to be like right away. It's obviously great if it's right away, but it can be over several appointments. Some effective communication techniques include plain language, explaining, visual demonstrations, intraoral images, the teach back method. The teach back method, most of them probably know, it's when you ask the patient to repeat back the information in their own words to confirm understanding. Example is, just to make sure I explain that clearly, can you show me how to clean around this area at home? Research shows that the teach back method significantly improves patient comprehension and adherence to your home care instructions that you give your patients. As a provider, reiterating what was spoken about during the appointment can also be helpful. Asking the patient to recite their quote unquote homework is and what their needs to be done to improve their oral hygiene at home. I like to say such things as, let's see how you're doing in 6 months. Also recommend affordable alternatives like dollar store items, letting patients know about places that offer deals like CVS, Costco, Sam's Club, Amazon, etc. You can also mention oral health centers that offer affordable care and resources such as Connecticut Mission of Mercy, which was just over the weekend, and COHI. So those are also things you can offer your patients who cannot afford certain things. Okay, next slide.
Alrighty, so next we'll be discussing equity in care. So oral health disparities remain a major public health issue. Patients may face barriers such as financial limitations, transportation challenges, disabilities, and language barriers. Patients with intellectual or developmental disabilities often experience higher rates of untreated dental disease. Providing equitable care requires recognizing unconscious bias and adjusting care strategies to meet individual patient needs. So a special consideration is encouraging patients to invest time into their care. A patient can do some searching online for resources such as transportation to appointments and visits. Um, the way they'll be able to find local clinics and dental schools in their area so they can find low-cost dental care. And another thing I thought about was the actual access to a smartphone or a computer. So even suggesting going to their public libraries to find resources that will point them in the right direction. COHI also has resources on our Oral Health Access Hub, which also mentions insurance options, finding a provider, patient resources, and a dental safety net facilities. Other programs that should be mentioned are CT Mom, the Connecticut Mission of Mercy, which provides free dental care. Yukon Health Center also provides affordable or low-cost dental care that patients may be interested in. It can be useful to inform our patients that local hygiene schools may offer free and affordable dental hygiene services that will be performed by students. I recently found out about the non-emergency medical transportation, NEMT, which provides services for transportation for eligible Husky and Medicaid members. This service helps individuals get to and from health appointments. And another great resource is ct.gov with more information for Connecticut residents.
And I also want to add, don't forget about the University of Bridgeport, which we both attend.
Yes, thank you.
They also provide discounted rates for dental care for Connecticut residents.
Thank you.
You're welcome. Okay, next slide.
Okay. Now let's dive a little deeper into special needs patients. So before the appointment is over, you should ask if there are any questions the patient or the caretaker or guardian has. When treating special needs patients, allow for additional appointment time. The use of visual aids can be very helpful, simplifying instructions for better comprehension, and also creating a sensory friendly environment. So you may want to actually turn down the music. You may want to actually reduce the lights more. Again, those glasses are really helpful. Um, and a strategy to help at home with caretakers specifically, because those with special needs may not be able to perform their own oral hygiene habits. You can provide them with how to sequence their health practices, stress proper dental hygiene routines for patient compliance. And then also, caretakers might actually ask, what products should I use first? I'll typically respond with, in my opinion, based on the patient's needs and what the dental products actually do and what they actually can provide for the patient will determine the application, order, and use. And you could also suggest helpful dental products that assist with home hygiene, such as flossing aids, demonstrating that their child's teeth will feel more natural if you would actually stand behind them and brush their teeth. Incorporating a water flosser, a 360 toothbrush, and there's also horizontal toothpicks, floss picks, for effortless plaque removal in the back teeth.
I find the 360 toothbrush for older or special needs children is really good because it just gets the whole mouth and they just like one swoop, they could just leave it in there. It vibrates and that's very helpful. I just wanted to add that. And they're way cheaper now from when they first came out.
And then another technique that I like to mention is something that I call the counting method. I was taught this method while at the Crack Elementary School working with special needs children. Method includes setting expectations for each step of the hygiene visit, along with explaining to the patient how much time each step will take. And you will say something like, we're going to do X, Y, and Z, and it'll take this amount of time for each step. Also to mention, currently COHI is also advocating for a House bill called 5399 in this current 2026 legislative session. House Bill 5399 is aimed to modernize dentistry regulations. And among these updates, there will be continuing education on how to provide care for individuals with intellectual or developmental disabilities. Making this update as important, making this update as a part of the recommended CE requirements. And you can visit our legislative priorities page for more policies we are advocating for. Dr. Waterman, can you add any more information on this topic for us?
Sorry, I couldn't get the mute off. Yeah, I mean the main thing I would say with special needs, especially adult special needs, particularly anyone who's had like a traumatic brain injury or patients who are having early dementia. Sorry, my dog is my side here. Is making sure that you balance talking with the caregiver, who often will be the kind of the point person, with with remembering that it's that there's an adult patient there and that they're who is being who you're dealing with. And so, that making sure that you don't make them like secondary. You don't want the patient to ever feel like they're being talked about, and they're not in the room. Um, and especially for anyone who's, hearing impaired or has some type of translator, you should be talking to the patient, and the translator can then translate. And it's difficult. I mean, I would love to say that I'm perfect about doing that, and I'm not. But it's just making sure that you're respecting the patient 100% of the time and making them feel like they are the center of the appointment, because they are.
That's good to bring up.
Yes, thank you.
Okay, next slide. This is our last objective, and it's team training. This is an ongoing discussion that truly matters, most specifically due to the fact that so much has and can change in the field of dentistry. New methods, materials, health practices, regulations, laws, and policies, etc., will and can evolve. Improving the patient experience requires collaboration across the entire dental team. Offices that prioritize patient-centered care often implement regular staff meetings, communication workshops, patient feedback systems, and team discussions on improving patient interactions. It's also important to encourage your dental team to stay current on recent technology, um, and changes in science and whatnot, like fluoride, fluoridation, other alternatives, explaining why and how fluoride works, mentioning xylitol products, MI paste are just a few. Some recent research suggests that lead aprons are no longer necessary because there is such a low dose of radiation when taking radiographs. A lead apron can store more radiation and can expose the patient to that radiation. Patients may be confused about the updates and practices performed by providers. It's obviously their choice, but it is good to bring up to the patients. Um, but being up to date
Smith
and
is going
current,
to start seeing clinical patients.
um, being up to date and current events and facts is important, and just try to help limit your patient's confusion. Um, Dr. Waterman, how do you and your staff prioritize like team training and building?
Um, well, I'm not necessarily, I've worked in the last few places I've worked have been DSOs, so I'm not technically in charge of team training. But the one thing that I think is absolutely paramount is that no matter where you are in the dental practice, if you're an assistant, if you're a front desk, if you're a dentist, if you're a hygienist, you need to advocate for your role. I'm not any good at assisting. And even if I were, I'm not as good as our assistants are. I'm not good with the front desk. So there's basically, for me as a dentist, and I think it's often the dentists that are the ones that kind of think they could do everything. And yeah, I mean, technically, in a lot of places, they're in charge. But and when it comes to the patient care, I guess ultimately they are in charge. But as a hygienist, as an assistant, as a front desk person, you need to advocate for your role in that. Um, and because if you don't, then you're not going to be treating the patients as well as they need to be treated. Um, and I think that's to me the most important thing about any dental office is that that and you need as an office to believe it. If you don't believe it, we talked earlier about the different cameras are available and what radiographs we have and whether or not we're going to wear the the, the lead apron. But if you don't get buy-in from the team members across the board, then patients can smell when you're trying to sell them something.
Yeah.
And it's not like selling the thing just like to make money, but just selling something to just like, this is what we do. We take these pictures because of this. No, it's like, hey, you were saying earlier, I like taking the pictures because I can show them this, right?
Yeah.
If you're excited about it, then the treatment modality, like, and you can, I like to talk in analogies. Other people may not like to talk in analogies, but they may have an equally exciting way that they get into it. And so as long as you have everyone on board, with doing their part and to kind of almost get excited about dentistry and excited about the patient, care process, then you're gonna have happy patients.
I agree. I think that also ties into like the self-care and pouring into yourself. Because if you feel good, you could be excited about it, and then your patient will be excited about it, and that will just be one nice cohesive treatment and visit for the patient. So I agree with that
Totally,
completely.
totally. Yeah.
I'd like to add to that too. I do feel such relief, I guess, at the end when I have a patient's like, wow, you were so gentle, thank you. And my response immediately is, it's my pleasure. Like I'm doing this because I love what I do and I want to provide care. And that's why I said, I will be taking care of you, and that's something I feel like, again, in my own experience, that not many patients get the chance, which I wish for the future will change. But in my own experience, again, I love what I do, so I want to translate that into actual action.
I like that. Okay, next slide. takeaways from the webinar. We're almost there, guys. Hope everyone has maybe taken away a little something from this webinar, but I just want to say being a dental professional extends beyond clinical procedures. We provide comprehensive healthcare that includes education, prevention, and patient support. Honesty and compassion play a critical role in reducing patient fear and anxiety. It's important to set realistic expectations and reinforce the improvements occur over time. These conversations should be clearly documented and revisited at future visits. Thorough and accurate documentation supports continuity of care and helps maintain good relationships with your patient, ensuring patients feel recognized and well cared for by all providers. Reducing anxiety begins with clear, empathetic communication. Practicing cultural competency and delivering equitable care is essential to meeting the diverse needs of our patients. Supporting a team-based, patient-centered approach enhances overall care and outcomes. The goal for each patient, they should feel safe, respected, heard, and valued. I believe that's something we all want, so they should feel that at their visit. Um, Compassion improves outcomes, communication builds trust, cultural competency strengthens care, and teamwork enhances the patient experience. Okay, next slide. We are done. I just want to thank everybody for their time. I hope you all did take something away from this webinar. A big thank you to Dr. Waterman for joining us.
Thank you very much, Dr.
Thank
Waterman.
Thank you, Leslie, for partnering up with me on this. I really enjoyed working with you and bringing this to fruition in both of our feedback. So at this time, I just want to say, Sandra, if you have any questions for her, how to get involved with COHI, it's up on the website. They do amazing things for Connecticut, like trying to get oral hygienists to be able to be in homes to give care, just to expand the amount of care and money that Connecticut residents can get for dental care. So it's a really important organization. So Sandra, thank you. And I also want to know if anybody has any questions or comments from the audience.
I have a comment. I just want to say it's people like, you and Leslie presenting like this that can help move people, away from being fearful for their health and actually take their health into their own hands and feel confident in what they're doing. So thanks for everything that you're doing.
Oh, thank
Thank
you.
you.
That was so nice. Anybody else? Sandra, I think you had some questions for us.
No, I just wanted to thank you both for wanting to be part of the Connecticut Oral Health Initiative. I'm sure Dr. Mark, if he could be on, who founded COHI 25 years ago, could see where we're at, not just in acknowledging the importance of oral health, but really uplifting the professionals that keep us all healthy. And so thank you both for really highlighting that. And to the comment that was made before, it's really important to make people feel comfortable, because being in a dental chair is not easy for a lot of people. And so I would say having you, Noshelle, and you, Leslie, as my dental hygienist, you can come at me anytime you want. So I think it's really important. So I appreciate you both for coming up with this webinar and for sharing your knowledge, right? And the love that you have for your profession.
Thank you. Also, Sandra, can you put up the next slide because it has the references? Everybody wants to screenshot
Absolutely.
those resources that we found.
Yes.
Just so we can see.
I can actually share it with everyone via
Okay,
email. So everyone who
perfect.
registered will actually get a recording, and they will also get a copy of the slides.
Perfect. Thank
Great.
you.
Thank you so much.
Thank you, everybody, for attending.
Thank you, everyone.
It means the world to me. I will let you go have dinner and eat.
Thank you, everyone.
Great
Bye.
job, everybody. Leslie, I'm so proud of you. You did amazing.
Thank you.
You're welcome.
Have a good night, everyone.
Thank you, Dr. Waterman.
You're welcome. Thank you, guys.
Thank you, Dr. Roman. You were great.
Oh, no, thanks.
Appreciate your time.
It was fun. It was fun.
It was fun.
All right.
Oh, we have a lot
You
in
guys
the
take care,
chat.
right?
Bye.
Oh, you do have a lot in the chair, yeah.
Yeah. Oh, that was so great. Oh.
So nice.
So
All right, guys,
nice.
have a great night, okay?
Thank
Bye.
you.
Thank you.
Take care. Bye.
Bye.
You have a love you, Noshelle.
Oh, we're
Paola?
oh, that's Spell. I work with her.
Oh,
That's sweet.
Oh, oh, lovely. Very nice. Is everyone? Bye, everyone.
you guys did great.
Ah, so
Yay.
nerve-wracking.
No,
I
you
want to
guys did
vomit. I
fantastic.
want to vomit.